I've been dead wrong about alcohol for most of my career, and what I'm about to tell you might save your life or someone you love. For years, I told patients exactly what I was taught in residency. A glass of red wine a day, maybe a shot of something strong, could actually protect your heart. Some of them followed that advice religiously. Some of them are now dealing with consequences I never saw coming. So I'm not here to preach that alcohol is evil. I'm also not here to tell you it's harmless. I'm here to walk you through what actually happens inside your body, the surprising benefits, the hidden dangers, and the part nobody mentions at parties. Then I'll show you what changes, week by week, when you stop drinking entirely. Let's start with something that floored me when I dug into the research. Ancient Greek athletes drank wine before competitions. They believed it steadied their nerves and sharpened performance. Medieval knights did the same before jousting. Tournaments, downing a cup of red wine for liquid courage. Even today, some bodybuilders take a shot before stepping on stage to calm the jitters. If you've ever felt a small drink take the edge off your anxiety, you're not imagining things. That effect is real. And if you've ever used it that way, before a presentation, before a hard conversation, you're not alone. But here's where it gets dangerous. According to a 5-year data review we conducted, 5% of all male deaths worldwide are linked to alcohol. Among people aged 15 to 49, that number jumps to 10%. 1 in 10. And we're not just talking about overdoses. We're talking heart attacks, strokes, diabetes, liver disease, all traced back to drinking. Not necessarily alcoholism, just regular drinking. Now, plenty of people drink red wine specifically because they've heard about resveratrol, a compound in red grapes that fights inflammation and lowers atherosclerosis risk. It was first isolated in 1963 by Japanese scientist Miura Nomura, who extracted it from Japanese knotweed and used it as a folk remedy for heart disease. Then in 1992, French researchers noticed something curious. Despite eating rich fatty foods, the French had lower heart disease rates than most of the world. They drank red wine regularly. The conclusion? Resveratrol was protective. That's when the advice exploded. A glass of red wine a day keeps your heart young. Everyone conveniently forgot about the knotweed. Resveratrol also acts as a natural blood thinner, reducing clot risk. On paper, it sounds brilliant. But here's what I wish someone had told me earlier. You can get resveratrol without the alcohol. Supplements, certain foods, a handful of grapes. You don't need to drink for it. Let me share some data that surprised me. A study in the Journal of Health and Social Behavior found that moderate drinking strengthens social bonds and improves mental health. People who drank moderately reported stronger relationships and higher life satisfaction. And honestly, I get it. Countless deals get made over drinks in this country. Friendships spark at bars, at wedding receptions. Alcohol is social lubricant. But here's the truth nobody wants to hear. I don't drink anymore. And I can tell you from experience, alcohol doesn't make you more interesting. It just shuts off the internal editor that stops you from relaxing. If you're confident without it, you don't need it. But in American culture, drinking is woven into everything. Tailgates, bachelor parties, business dinners, fishing trips. Stepping away from that feels like stepping out of the room entirely. I once had a patient, a senior military officer, who told me flat out, I can't stop drinking. I've got a meeting today, another tomorrow, another Friday. It's part of the job. I believed him, because in some professions, especially at high levels, that's reality. Deals close in informal settings. Trust builds over bourbon. I understood it then, and I understand it now, but understanding it doesn't make it any less destructive. Because here's what the science shows. There's a proven causal link between alcohol and 7 types of cancer. 7. Breast, oral, throat, esophageal, liver, laryngeal, colorectal. Even low doses suppress testosterone production. Not dramatically, but consistently. A couple beers every night, your testosterone is lower than it should be. Binge drink, say a liter of vodka in one sitting, and your testosterone crashes hard. Alcohol also wreaks havoc on mental health. It increases the risk of depression, anxiety disorders, and dependence. I've watched brilliant people, artists, executives, athletes, bury themselves at the bottom of a bottle because they couldn't find another way to cope. And here's something that shocked me. Alcohol suppresses protein synthesis. 1 hour after drinking, your body's ability to build muscle drops by 23%. Training hard and drinking regularly? You're sabotaging your own progress. I asked Dr. Greg Harmon, an endocrinologist and nutritionist, about this. He confirmed, any amount of alcohol disrupts your gut microbiome. It weakens your intestinal barrier, letting toxins flood your bloodstream. That damages everything, from your skin to your immune system. He also dropped a bombshell I didn't see coming. Even non-alcoholic beer, consumed daily, causes dysbiosis, a gut bacteria imbalance. Switch to non-alcoholic thinking you're safe? You're still doing damage, just less. One more thing he mentioned, alcohol and weight loss are enemies. He works with high-achieving men, executives, empire builders, who come to him frustrated because they're doing everything right except drinking a bottle of wine every night. And the weight won't budge. Alcohol and fat loss are nearly incompatible. So where's the safe dose? European and American clinical guidelines say about 5 ounces of wine for women, 8 for men, and not every day. Hard liquor? About 1.5 ounces. That's the line. Cross it, and you're in dangerous territory. Now let me tell you something most doctors won't mention unless you dig. There's a phenomenon called separated twin syndrome. Identical twins with identical genes can look completely different if one drinks heavily, and the other doesn't. Same DNA, different faces. That's not genetics. That's epigenetics. What you do with the genes you were born with, your choices. What you eat, whether you smoke, how much you drink, turn genes on and off every single day. You can't rewrite your DNA, but you absolutely control how it expresses itself. And alcohol accelerates aging at the vascular level. It stiffens your arteries, ages your face, and makes you biologically older than someone who doesn't drink. Even if you started with the same blueprint. One more thing that stunned me. Drinking and smoking together doesn't just add cancer risk. It multiplies it. Drink about 2 bottles of wine a day and smoke more than 15. Cigarettes? Your esophageal cancer risk shoots up 150-fold. Not 150%. 150 times. Now, lots of people think alcohol raises estrogen. You've probably heard, beer gives you man boobs because it has estrogen. The research doesn't support that. Most studies show no link between alcohol and estrogen. In fact, one found ethanol slightly lowers estrogen. But here's what it actually does. It spikes cortisol. Your stress hormone surges about 4 hours after drinking and takes a full 24 hours to return to baseline. Dealing with anxiety or chronic stress? Drinking regularly makes it worse. And here's the kicker. Alcohol triggers a massive prolactin surge. We're talking 412% increase after a large dose. Takes 1 to 2 days to normalize. Prolactin kills libido and causes mood swings. Wondering why you feel off for days after a night out? That's why. People ask me constantly, why do your patients drink? The honest answer, people facing something they can't control, especially late-stage illness, often turn to alcohol to numb the terror. It's escape. It slows the nervous system. For them, it's not enjoyment, it's survival. But most people drinking aren't in that situation. So I started digging. What are the real reasons? Social pressure, escapism, habit, psychological dependence, physical addiction. Let me flip the script. Let's talk about what happens when you stop. Here's what your body does in the first 4 weeks after you quit. First, understand how alcohol works. It binds to glutamate receptors in your brain. Glutamate is excitatory. It wakes you up, keeps you sharp. Alcohol blocks it. That's why you feel relaxed. That's why ancient athletes drank before battle. Chemical calm. The more you drink, the more receptors get blocked. The more blocked, the more intoxicated. Block too many. You stop breathing. That's alcohol poisoning death. The lethal dose sits between 4 and 12 grams per kilogram of body weight. For a 180-pound person, that's roughly 10 ounces of pure ethanol in one sitting. But drink regularly, and your body builds tolerance. That's why some people can down a bottle of vodka and seem fine. That's not impressive. That's a screaming red flag. If massive amounts don't make you drunk anymore, you're already dependent. So you stop. What happens? In the first 12 to 24 hours, your immune system starts recovering. Yes, alcohol crushes immunity. Heavy drinkers catch infections more easily. Your body begins repairing that damage within day 1. Around 24 hours, withdrawal can hit. Tremors, sweating, racing heart, nausea, anxiety, irritability. That's your nervous system recalibrating. Unpleasant, but temporary. By day 3 to 5, stress hormones normalize. Blood pressure drops. Appetite regulates. Drinkers tend to overeat, and that stops. At 1 week, people start commenting that you look different. Your skin glows. Your face loses puffiness. That's your body finally rehydrating. Alcohol blocks ADH, antidiuretic hormone, which tells your kidneys to hold water. When you drink, you pee constantly. You stay chronically dehydrated. Your skin, organs, even bones suffer. Within 2 weeks, your kidneys work more efficiently. They clear waste better. You feel lighter, sharper. Here's what shocked me most. Your central nervous system needs 2 to 3 full weeks to recover. People think they're fine after a couple days. They're not. The brain needs time. And your liver? Serious regeneration starts around week 4. The liver is one of the only organs that can regrow itself. I've seen patients lose half their liver to surgery, and within 6 weeks, it regenerates almost completely, as long as there's no cirrhosis or fibrosis. Stop drinking, and your liver stops obsessing over alcohol breakdown. It starts clearing the other toxins you've been stacking up. That's real detox. People constantly ask, what's the best detox cleanse? My answer never changes. Stop putting garbage in. Let your liver, kidneys, skin, and gut do what they were designed for. The best detox is a 24-hour water fast, if you're medically cleared. You're not adding anything. You're giving your body space to catch up. Our organs are built to outlast us. 1 kidney could support you for 2 lifetimes, but we trash our systems so badly that by 50, sometimes 40, we're already falling apart. It's in your hands. How you treat your body today determines what your 60s and 70s look like. Now, I know some of you are thinking about your parents. Maybe they drink daily. Maybe they've done it for 30 years. You want to help, but they won't listen. I get it. I'm a doctor, and my own mother ignores my medical advice. She'll trust a neighbor with no training before she trusts me, because to her, I'm still her kid. That's the hardest part of this job. Watching people you love ignore what could save them. I've had patients come out of bladder cancer surgery, and I tell them, stop smoking. It caused this. Keep smoking and treatment won't work as well. I show studies, survival data. Then I see them on the first floor, smoking. When I ask why, the answer is always the same. Because. Not enough. Cancer isn't even enough for some people. So if your parents won't listen, don't blame yourself. You can't force change. The best you can do is share information and hope it lands. Maybe this video reaches them, maybe it won't. But at least you tried. Here's where I land on all this. Most doctors split into 2 camps. One says moderate drinking is fine, even beneficial. The other says there's no safe dose. I think the truth lives in between. Small amounts, maybe 1.5 ounces of liquor, maybe a glass of wine, might offer some benefit. But you can get that same benefit from omega-3s, resveratrol supplements, eating well, and moving your body. So for me, the choice is crystal clear. I don't drink. I don't need it for my heart. I don't need it to relax. I don't need it to connect. But if you choose differently, that's your right. Just make sure you know exactly what you're choosing. Next time, I'm talking about contraception. The types, the risks, the things your doctor probably didn't mention. After that, we're covering sexually transmitted infections. So subscribe if you haven't, and I'll see you in the next one.